Helping Seniors Television, all about improving quality of life for seniors. If you're a senior, know a senior, or plan to be a senior, then this show is for you. It's all about helping you develop your own aging plan so you can age actively and with dignity. Helping Seniors Television from the Helping Seniors Network of information, education, and resources.
We're here to talk about Knowledge College for Aging. It's all about getting your ducks in a row. Remember, that's been our theme. You guys gave us a great little a little plaque with the ducks in a row. It's about getting your aging plan. Joe Steckler, who is our founder, and now he's president emeritus. Joe was always talking about you got to have the aging plan, getting your ducks in a row. So that's our cute picture of ducks in a row. Get it? Okay. That's another cute picture of ducks in a row. Get it? So, and there's a couple of things that we always add to this. We say, be wise like an owl. Don't try this on your own. And Vicki is really going to teach us about this because you see all those ads. You see all those ads that start flooding the TV. Your mailbox gets full with all this stuff, and everybody's telling you this is the best plan. And you see the guy you liked on TV back in the 70s who was on your favorite TV show, and now he's a Medicare expert, and he's going to tell you what's right. You know, I mean, actors should act, and experts who know Medicare should do Medicare. So I'm just saying, that's just me. So we say get good local help. So that's caveat number one. And then caveat number two is don't be an ostrich. So most of these things, like even if you thought, well, I had a good plan this year, I think what Vicki's going to share with us is there's lots of changes. And so don't assume that worked well for you last year is going to be the right thing for you this year. Ladies and gentlemen, Vicki Moore,
Hello.
Moore Insurance Solutions. Get ready to learn.
Good morning. Good morning. So nice to be here. As Kerry said, I am Vicki Moore. My company is Moore Insurance Solutions right over here. You see the sign over there, it says spooky. And of course, that's a nice little Halloween sign, but also, I think it kind of relates well to Medicare. Sometimes Medicare, especially if you're new to Medicare, can be a little spooky. Just, you know, kind of learning to navigate Medicare. So that's, and then even this time of year when you're trying to navigate, okay, what's the best plan for me? So that's what we're going to talk about today. We're going to talk about just like Medicare, kind of a Medicare 101. It is Humana branded, this presentation is, but I am a broker, so I deal with all plans. But this just is a good presentation that kind of gives you a nice overview. And then after this, I'm going to show a video that gives us a nice overview of the new Inflation Reduction Act. A lot of you may have heard of that. This is going to give us a little information on that too. But this is going to just kind of give you some basics of Medicare. How many people in this room have Medicare? Okay, we got a lot of us. So probably, do we feel like experts in the field right now, since you've had it maybe for a while, or maybe you're new? Any experts? Anybody feel like they know it really, really well? So it's always a few questions. Yeah, even, I mean, I've been doing this for, I moved here about 6 years ago from Indiana. I began in the insurance industry back in Indiana. So it's been about 10 years I've been in the field, and questions come up all the time. It can be a little spooky. So anyway, let's get started. Okay, so what is Medicare? Medicare is a health insurance program run by the federal government. Medicare has 4 parts. It's got the Part A, which is your hospital coverage, your Part B, which is your medical coverage, and then there's the Part C, which is also the Medicare Advantage plans. That combines Part A and Part B, plus some other benefits. And I do get that question a lot. A lot of people that have had Medicare for a while are like, you know, I've been reading about the Part C. I think I need the Part C. And I'm like, well, you've had a plan for several years, so you've actually had the Part C. So not everybody realizes Part C is Medicare Advantage. Part D, prescription drug coverage, and then together you got your Part A, your Part B. That's all called Original Medicare. To be eligible for Original Medicare, you are eligible for Original Medicare when you are at least 65 years old. So if anybody is just turning 65, if you're already 65, you might have a family member or a friend. You might let them know, remind them, you know, you need to start thinking about your Medicare. Even if you still work, you could still be eligible for Medicare. Or you could be under 65 and qualify due to a disability or other special circumstance. And you have to be a U.S. citizen or a legal resident who has lived in the U.S. for at least 5 consecutive years. So you can come from another country and just be working in the country and still be eligible for Medicare. Okay, so understanding our Medicare options. To help you decide the best fit for you, just like a little overview. So First thing is to enroll in Original Medicare, which again is offered by the federal government. Part A helps us pay for our hospital stays and our inpatient care. Part B helps us pay for our doctor visits and our outpatient care. So if you don't enroll in Part B when you're first eligible, you'll pay a penalty if you sign up later. The penalty increases and you have it the rest of your life. So, but don't panic. Because a lot of people these days are working past 65. So, you may not take your Part B right away. And as long as you show credible coverage that you've been getting your coverage through your employer, you're not going to get a penalty. So, don't panic. If you cancel Part B coverage, you won't be able to re-enroll until the next January, and re-enrollment may come with a penalty. So there are people that think, well, Part B is really expensive. I just don't know if I need it, and they've canceled it. So, there is a time period you have to wait to get re-enrolled again. Okay, so after enrolling in Original Medicare, you can enroll in a plan with additional coverage offered by private companies. So you do have to have your Part A and your Part B to be able to choose a plan. So your option 1 is you can choose a Medicare Advantage plan, which again is that Part C. It's made up of Part A and B, and it can include your Part D prescription drug coverage as well as additional coverage. Because just as a reminder, Original Medicare does not cover or does not include Part D. But if you enroll into an Advantage plan, oftentimes that will include that. Medicare Advantage enrollees can also purchase individual dental and vision plans or combined dental, vision, and hearing plans for added coverage. So oftentimes the Medicare Advantage plans will include that, but you can add on to that if you don't feel like it's enough. Because oftentimes it's mostly preventative, especially, with the dental. The other thing is you may add Medicare Part D to which is a standalone prescription drug plan, or if you have a Medicare supplement that helps you pay for some of the Original Medicare out-of-pocket costs, and individual dental and vision plans or combined dental, vision, and hearing plans. So you've got your 2 options, Medicare Advantage option, Medicare supplement option. And when I'm first meeting with people that are just new to Medicare, turning 65, my job, I feel like, is to educate you on what those options look like and what that looks like for you down the road. Because sometimes it's a hard decision trying to decide which way to go. So beyond Original Medicare, so you have the chance to get even more beyond Original Medicare with Medicare Part C and D. So again, Part C, Medicare Advantage plans are offered by private companies under contract with Medicare. Companies may offer plans with different levels of coverage, and you want to check the plan's medical coverage, making sure it's offering what you want. Part C and D, Medicare Advantage prescription drug plans. Medicare Advantage prescription drug plans are offered by private companies under contract with Medicare. Companies may offer plans with different levels of coverage. And then Part D is your prescription drug plan, which is a standalone plan. Okay, so there's different types of Medicare Advantage plans. We have HMOs, which that stands for Health Maintenance Organization. We have PPOs, which are Preferred Provider Organizations. There's also something called a PFFS, Private Fee for Service. And then there are special needs plans. If you qualify, you have to qualify for those. Doing this for as long as I have, I've really never dealt with the PFFS plan. So we're going to kind of focus on the HMOs, PPOs, special need plans. The Health Maintenance Organization, or the HMO. So they are plans that have a network. So you need to make sure that you are choosing a plan that has, if you have particular doctors, that they're in the network. Most of these HMO plans, you are going to need a referral from your PCP to see a specialist. Out-of-pocket costs may not be covered for non-network providers and facilities, and they will not be covered, really. So if you have a plan and you have a doctor that you want to see and they're not in the network, you're going to have to pay out-of-pocket for them. Select HMO plans include point-of-service benefits. If that's the case for your plan, you may use out-of-network providers. So if you do see sometimes HMO-POS, that's that point of service, and that sometimes does allow you to go out of the network with an HMO. And then you've got your PPOs, your preferred provider organizations. Some PPO plans often have emergency coverage when you travel worldwide. You can go to any doctor, specialist, or hospital that accepts Medicare and the plan terms. No referrals are necessary from your PCP when you have a PPO. Now, I will say, there are definitely PPOs that do not, even though they do not make you get a referral, there's definitely sometimes doctors or providers that still want a referral. And they still may say, well, we just don't want to take your plan. They have even though the plan will let you go out of network, that still could happen, and it does happen. There may be higher cost sharing or no coverage from the plan if you receive care from out of network providers, except for emergency care. So oftentimes, even though you can go out of network with a PPO, your copays could be higher. I will say there are plans in this area that you can go out of network and it's the same cost. So that's why it's important to shop around if that's something that might be important to you. So if you have a PPO and you're paying a higher cost when you go out of the network, check, because there could be plans that would not make you do that. And we're just going to pass that private fee for service. Okay, so another thing we have are special need plans. And there's different types. There's some that are based on income, and those are called dual eligible special need plans. And you'll see that DSNP, that's what that stands for. And there are also some plans that are chronic condition special need plans, which you're going to see that CSNP. And so with both types of plans, you do have to qualify. So again, with the DSNP, you have to qualify based on income. And that is something somebody like myself can always check for you. And circumstances change. Maybe you never qualified for one of those plans in the past, but maybe you've lost a spouse and so no longer have a dual income. So that can kind of change things for you. So circumstances can change throughout our lives. Same thing with the chronic. That's going to be, you're going to qualify for one of those plans based on your medical conditions. Oftentimes it's diabetes, it could be pulmonary, lungs, it could be heart issues, sometimes dementia issues would allow you to qualify. And the nice thing about these plans is that typically you can go into them throughout the year. You don't have to have those special periods like we're in right now. So different reasons you can qualify for them. There's also something called an institutional special needs plan. So that is somebody that's in a long-term, like a skilled nursing and nursing home facility. So that's another thing as well. So the benefits of a dual plan, based on your income, it's going to offer additional benefits to supplement your Medicaid coverage. It includes, so when you are dual, you're going to have the Medicare and the Medicaid. It's going to include enhanced care management services. The plans are going to really have a really close focus on you and make sure you're getting all of the care that you need. Typically requires you to use in-network providers except in emergencies. PPOs are often offered in some markets, and we do have some of those in this market actually. And they're typically going to include your dental, your vision, and your hearing. And if you're seeing all those ads on TV that look really, really great, and I get those calls all the time, I want that food card, I want that $4,000 in dental benefits. Oftentimes those plans are geared towards people that have the dual plans. And so they look really good, but you have to qualify for them. And then the chronic plans, they include enhanced care management services as well. They offer a large network of providers. They typically require you to use in-network providers as well. And again, they're going to include the dental and things like that. Do we have, we'll just come back. We'll do questions at the end if we have questions. Okay, Part D, this is your prescription drug coverage. And this is a big thing. This is where we've got a lot of changes for the upcoming year. You have two options for getting your Part D coverage. Again, you can join a Medicare Advantage plan and you can do a standalone prescription drug plan. So if you join a Medicare Advantage plan, most plans do include your Part D, but there are some, maybe if you're a veteran, that you don't want your Part D. You might get your medications through the VA. So you have both options, but then if you have a supplement, you can also add that prescription drug plan. And in fact, I highly would recommend it. And this is just branded plans. Humana happens to offer 3 different prescription drug plans. But so what to know about prescription drug coverage? There is something called step therapy. So even if the medications you take are included on the plan's drug list, you may need to try certain drugs first to treat your health problem before moving to more expensive drugs. You may have to get prior authorization. Some medications may require your doctors to get approval, prior authorization from your plan before they can be covered. And then there's something called preferred cost sharing. So you may pay a lower cost for certain medications by using network pharmacies with preferred cost sharing. For these plans, Humana actually has their own mail order pharmacy, and whatever plan you have, oftentimes they do have their own mail order pharmacy. I was with a couple last night who they picked a new plan because the plan that they had was no longer in the market. So they had to shop for a new plan, and they both had a lot of medications. And so the price really varied, because their choice pharmacy happened to be Walgreens. Well, Walgreens did not happen to be a preferred pharmacy for that plan. So their medication was actually a lot higher. Once we switched to a pharmacy that was preferred, it dropped the cost. So those little things like that you don't always think about can make a difference, can save you money. And that's the kind of thing that somebody like myself, a licensed insurance agent, can take a look at. And I will say, you can go to Medicare.gov and you can plug your information in there and get good information there too. So what to know about prescription drug coverage? So there are tiers. Prescription drugs are organized into tiers according to cost. Tier 1 is the lowest and Tier 5 is the highest cost. Plans may offer the best pricing on Tier 1 and Tier 2 drugs. So a Tier 1 is going to be a preferred generic, and that, again, it's going to be your cheapest. Oftentimes it's a zero copay. Tier 2 is a generic. Tier 3 is a preferred brand. Tier 4 is a non-preferred drug. Tier 5 is typically specialty tier. Tier 6 is going to be a select care drugs. And every plan, whether it's Humana or Aetna, their tiers can look a little different, but this happens to be Humana's. And the stages, this is one of the things, this is an important thing, which we're going to look at a little closer in a minute. Due to the Inflation Reduction Act, there are some changes for the upcoming year. So there's no longer 4 stages. There's now just 3 stages. So the first stage, Tier 1 or Stage 1, is your deductible. And if you have a plan, you may never have had a drug deductible, but maybe you have one for the upcoming year. So that things are looking a little different for some plans. But the first stage is that deductible stage. You may or may not have that. So you're going to pay 100%. You pay all costs until that deductible is met. The max deductible this year is $590. That's the most any plan can charge. So that has gone up a little bit for the upcoming year. A deductible is, of course, the amount you pay for your Medicare costs before the plan pays its share. Deductible amounts and exclusions vary across plans. Some plans may exclude commonly used medications from the deductible stage. So oftentimes you'll see, all right, the deductible does not kick in until a Tier 3 or a Tier 4. It just depends on the plan. Stage 1 is the initial coverage. That is your shared cost. So you're paying a share of the cost. The plan's paying a share of the cost. That's your copay. So during the initial coverage stage, the plan pays its share of the cost of your covered prescription drugs, and you pay, which is what I just said. So both you and your insurance plan are going to pay medication costs until you reach the out-of-pocket max, which is brand new this year. Starting in January, it's $2,000. So that's really actually pretty good news. That is the most you'd ever pay in a plan year for your medications. It used to be $8,000. So that's a big, big savings for somebody that has a lot of expensive medications. Stage 3, the catastrophic coverage. As you notice, we skipped a stage. There used to be that donut hole or that coverage gap. That's gone. That's one of the things that's been eliminated. So the catastrophic stage, once you reach that stage, which now is $2,000, once you get to $2,000, the plan's going to pay 100%. So you will never again pay over $2,000, of course, unless legislation changes. So during this stage, you pay nothing for the remainder of the calendar year. The plan is responsible for the full cost for your covered Part D prescription drugs. And there's something called extra help. So if you're somebody, maybe you do not qualify for a Medicare savings plan or a dual plan. Again, it's all based on income, but the levels are a little bit higher to qualify for extra help. So if you think your income is low enough that you could qualify, it's always worth asking. It's always worth checking because it is a government program to help people pay for their Part D prescription drugs. It is a federal program. So it's not like with the Medicaid, the Medicare and the Medicaid, that is a state and it looks a little bit different in every state, but LAS is a federal program. So it's going to look the same all over the country. So you may get assistance paying for Medicare prescription drug program costs like premiums, deductibles, and cost shares. And again, you can call 1-800-Medicare. That's something myself, a licensed agent, can check on for you and help you with. And your plans could include, and typically do include, the extra, virtual visits, home health, pharmacy services. They, like I mentioned, Humana uses CentraWell. So the plans typically like to get involved and can do a lot to help. So that's pretty much it. Just kind of a Medicare 101. Anybody have any questions about any of that? Oh, okay. I'm sorry, to see if it's covered with your plan. Well, you can go, that's something I can check for you. I think it depends on the, well, it could vary between plans. It could, because every plan has its own formulary that they use to, to make sure you want to make sure that medication is on that plan. And, maybe it's not the name brand. Maybe they have a generic form of it that could be covered. You can go to 1-800, you can go to Medicare.gov. You can plug in your medications and it will tell you, what plans covers it. And somebody like myself can check it for you too. So that's something, like I can check that for you and let you know what your preferred pharmacies. So it's not just like, oh, I prefer to go to CVS because it's close to my house. That doesn't necessarily mean that's your preferred pharmacy. Every plan has their preferred pharmacies, such as Aetna. They partner with CVS, and some others would be preferred. But that was the plan we were looking at last night. It was an Aetna plan, and they liked Walgreens. Walgreens was considered a standard pharmacy, so the rates weren't quite as low. You're going to get lower copays when you have a preferred. And it's just going to vary depending on the plan that you have, what their preferred pharmacies are. And even some of the local pharmacies could be preferred pharmacies. So it's just something that you need to check. You can check online with your plan. You can call member services with your plan. Your agent can check that for you. So there's lots of different ways you can check it. Yeah. So any other questions?
Prescription, you said like the $590 and then $2,000. The $2,000 is the
that is the max beginning January 1st. And I have a video that I was going to show. I don't know how much time I have, Kerry. Do I have time to show the video? And that'll give you more information on the Inflation Reduction Act. So $590 is the max for the deductibles. So the deductibles can vary from plan to plan, and it's up to the plan to decide what they want that to be. And well, you'll kind of get a better understanding, I think, once we watch that video. So let's watch that video, and then after that, we'll do more questions on that. So as I said, and I say a lot, I am a broker, so I represent lots of companies. So we looked at a Humana branded plan, and this just happens to be a United video. So I'm not a proponent for any particular one. I think it's very important to do a needs analysis and make sure what is the right fit for you. This just happens to be United. They have a good video that explains this Inflation Reduction Act for 2025. So we're going to take a look at that.
Hello. As a Medicare provider with over 45 years of experience you can count on, United Healthcare understands that Medicare coverage is personal, and changes to your coverage can affect your life. That's why we want to keep you in the know about some changes brought by the federal government, impacting all standalone Medicare prescription drug plans and Medicare Advantage plans with prescription drug coverage in 2025. Let's get started. We'll cover 3 big updates: removal of the coverage gap, a lower maximum out-of-pocket amount for prescription drugs, and a new prescription payment plan option. First, good news. In 2025, the coverage gap, also called the donut hole, has been removed. There are now 3 Part D prescription drug coverage stages: an annual deductible stage, initial coverage stage, and catastrophic coverage stage. If a plan has a prescription drug deductible, members will be responsible for paying the full cost of their drugs until they reach this amount. Then, in the initial coverage stage, they will be responsible for paying copays or coinsurance. Once the member and others on their behalf have paid a combined total of $2,000 for Medicare-covered medications, including any amount toward the deductible, the member moves straight into the catastrophic coverage stage, where they will pay $0 for Medicare-covered Part D drugs for the remainder of the plan year. See? More coverage, no gap. In 2024, for all Medicare members, no matter what insurance provider they were enrolled with, the Part D out-of-pocket max was $8,000. In 2025, the out-of-pocket max is lower than ever. Once a member and others on their behalf have paid a combined total of $2,000, they'll pay nothing for Medicare-covered Part D prescription drugs for the rest of the plan year. However, while the goal is to lower prescription drug expenses, these changes could result in higher deductibles or premiums in 2025. This means members may pay more earlier in the year during the deductible stage, but could see an overall savings compared to prior years with the lowered out-of-pocket maximum. Also for 2025, there's a new optional program called the Medicare Prescription Payment Plan. Instead of paying all your out-of-pocket costs when you fill your prescriptions at a network pharmacy, You can spread these payments out over the plan year with monthly bills. It's important to know this program does not lower prescription drug costs. The payment amount may change each month until you reach the $2,000 out-of-pocket max. So while monthly payments may be more manageable, they may also be less predictable. Your plan sponsor may contact you if you're likely to benefit from the program. For any questions or to find the right United Healthcare plan for you, chat with a Medicare plan expert live on uhc.com/Medicare. No matter the changes, United Healthcare offers reliable coverage you can count on for your whole life ahead.
All right, so did this raise any more questions, or did it answer some questions for people? Yeah. So I will say that the Inflation Reduction Act is good in a lot of ways. And, I'm not talking as a whole, the whole Inflation Reduction Act. That was, I think that came into law in 2022, had lots of components, but I'm kind of focused on the Medicare, the prescription drug components of it. So it's really good for people that have had a lot of expensive medications and maybe a lot of medications. Anybody in this room ever fall into the coverage gap or the donut hole? Yeah, it's not a place that you really wanted to be because your copays went up so much. So not good. So this is definitely going to be helpful. But on the other hand, and they kind of touched on it in this video, what is also happening, and if those of you that have Medicare, that in the end of September, you get that letter in the mail. It's your annual notice of change letter, and that's what tells you what your plan looks like this year, what it's going to look like in next year. And in a lot of the plans, you were probably seeing higher deductible amounts for the drug portion. You may have seen higher, and it's not just the drug part that's changing. There's actually plans in the area that have gone away. Cigna, they have taken away their PPOs in the area.
This is not her first rodeo, right? So then she's been studying all summer, because that's what you get to do. You get to go to school, because what you got to learn all the Medicare changes, and then you got to learn all the plan changes around it. So you're getting a wealth of wisdom. That's my point. So thank you, Vicki, for sharing this morning.
I'm Joe Steckler. Thank you for joining our program today. I'd like to remind you that our senior information line is available to you at 321-473-7770. There you can get help and direction that could be helpful for your specific situation or circumstances. The work of helping seniors is very important, but we can't do it alone. That is why our sponsors here in Brevard County are so important. I'd like to thank our many area sponsors, businesses, and medical providers who support the mission of helping seniors that help us carry the cost of our media efforts. If you'd like to join us either as a business partner or simply donate as an individual, we welcome your call at 321-473-7770. You are always welcome to visit our website at www.helpingseniorsofbrevard.org. Thanks so much for your help. It does make a difference.